Good afternoon and welcome everyone. Thanks so much for taking time to join us today for today's live webinar. Today we welcome back some guests from the Ministry of Long-Term Care to discuss recent changes and in pandemic response guidance. The content of today's session has been tailored for our resident audience, and we've enlisted the support of two OARC resident leaders, Stephen Wenzowski, from Hamilton, Ontario, and Gail Ramsden from Ottawa. Thank you so much for being here, Stephen and Gail. Our resident leaders are going to support us during the question and answer portion of today's session to ensure that resident questions are prioritized and residents can engage directly with our ministry partners. We have protected half of our time today for resident questions and engagement. So we received a number of questions in advance of today's session with your registration. So thank you for sharing those. But we will have the question and answer box being monitored closely so we can also pull out some of your live questions today. Before we jump in, I'd like to share a few other logistic items with you. You'll notice that all participants are in listen-only mode, and we've done this in an effort to really minimize any background distractions and noise for our speakers. We have also enabled the closed captioning feature for those who'd like to utilize that. And a reminder that today's session is being recorded for education purposes, and we will be circulating this recording and posting it on the OARC website. We will also have the slide deck available to participants as well. Now, before we get started, I do want to take a moment to share the Indigenous land acknowledgement. Together, let us now pause as we acknowledge the Indigenous peoples of all the lands that we are on today, from wherever we are virtually participating in today's meeting. Let us take a moment to acknowledge the importance of the land we each call home. We do this to affirm our commitment and responsibility to improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. We acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people who call this nation home. Let us now join in a moment of reflection to acknowledge the harms and mistakes of the past and to consider how each of us in our own way can move forward in a spirit of reconciliation and collaboration. Thank you. Now at this time, I will welcome our first speaker today. We'll kick off our presentation, Christine Laurero, who is the Director of Service System Planning and Operational Issues Branch at the Ministry of Long-Term Care. Welcome, Christine, and members of your team. Thank you so much for being here.
Thank you, Melissa, and thank you to the OARC for co-hosting this event with us. We're pleased to come here today to go over some of the recent changes with residents and answer your questions. So why are we here today? We introduced some changes. We announced them a couple of weeks ago and they came into effect last week. In terms of the pandemic response measures that apply in long-term care homes. So we want to go over some of those key changes with you, as well as provide some information on COVID-19 vaccines. Now, we did have a chance to talk about vaccines at the last session that we were at, but we thought it would be good to come back here again today and answer any questions you have, and also provide some updates. Next slide, please. So in terms of context, we know COVID-19 will continue to evolve and circulate in the community, along with other viruses such as the flu. But we also know now how to protect ourselves and prevent severe illness, such as through vaccines, access to therapeutics, and some important health and safety measures like hand hygiene and masking. As we have throughout the pandemic, we've worked closely with our public health officials and the Chief Medical Officer of Health to monitor the trends and evidence as we look to update our guidance and to make sure we're striking that right balance between protecting health and safety at this point in the pandemic, while also prioritizing that overall well-being of residents. And we've heard a lot of feedback from residents such as yourselves around what's important to you at this point in the pandemic, as we're all learning to live with COVID and seeing other measures that apply in the broader community. So the next few slides will be going over what some of those key changes are. And so with that, I'm actually going to turn it over to the manager on my team, Tanya Bass, who will go over those changes with you. So we can go to the next slide, and over to you, Tanya. Thank you.
Thanks, Christine. So we heard that residents miss seeing the faces of their loved ones. So while masks are still required, there is no longer a ministry requirement for visitors to wear masks when they are alone with a resident in their room. For residents living in shared rooms, homes should make their best effort to designate a space to enable residents who would like to interact with their visitors without a mask, where it is feasible to do so. Homes can now also return to their regular practice, whereby the long-term care home operator is responsible for setting their own visitor policy. This means that there's no longer a provincial requirement of 4 visitors per resident at a time. Next slide, please. The requirements have shifted from active to passive screening for staff. Passive screening means that staff will self-monitor for symptoms as part of regular practices. However, we're continuing to recommend active screening for visitors and caregivers. And active screening means that there's some form of attestation or confirmation of screening, such as a pre-arrival or an in-person questionnaire. While daily screening of residents to monitor for symptoms will continue, residents will no longer be required to be tested after an absence, unless the resident has symptoms. Next slide, please. Residents who have been in close contact with a person with COVID-19 are no longer required to isolate, unless they have symptoms or are a roommate of a person with COVID-19. The definition of a confirmed outbreak has been updated to 2 or more residents with COVID-19 that have a common link within a 10-day period. So this definition no longer includes staff or visitors. These changes to the definition and to isolation requirements for close contacts will help manage the staff absences this fall and also reduce the negative impact of prolonged and repeated isolation on residents, while still optimizing for safety within long-term care homes. Next slide. Staff close contacts are able to return to work without isolating, provided that they have no symptoms and follow appropriate precautions. Staff who test positive for COVID-19 or who have symptoms of COVID-19 but test negative may only return to work after following appropriate guidance. So for example, those staff that test positive may return to work 10 days after their symptom onset, provided they have no fever and their symptoms have been improving for 24 hours. Next slide. We also want to talk to you about the bivalent booster. So we know that vaccines continue to provide good protection from serious illness and fatal outcomes, but we also know that that protection decreases over time. As we anticipate a challenging fall and winter respiratory season, it is most important to get a booster and stay up to date with your vaccinations. Getting vaccinated is the most important thing you can do to protect yourself and your loved ones. Last month, the government started to roll out the bivalent booster, which elicits an immune response and provides protection against both the original COVID-19 virus and the Omicron variant. It is strongly recommended the long-term care residents, staff, and caregivers receive their bivalent booster as soon as possible, which is at least 3 months after their last dose or COVID-19 infection. Next slide. Both the Moderna and Pfizer bivalent boosters have been Health Canada approved and offer much better protection against the Omicron variants than the original COVID-19 vaccine. Right now, there's no evidence that one brand is more effective than the other, but the timing of getting your booster as soon as you're eligible is most important. As of last week, almost 40% of eligible residents received their booster. Residents can get their bivalent booster in their long-term care home, while caregivers can get it in the community settings such as pharmacies or vaccine clinics, as well as some long-term care homes. And as a reminder, all COVID-19 vaccines authorized in Canada are safe, effective, and of high quality. Next slide, please. Homes have also started to receive their influenza vaccine. The bivalent booster vaccine may be given at the same time, the same day, before or after any non-COVID vaccine, such as the flu vaccine. However, we don't want you to wait for the influenza vaccine before getting your bivalent booster. For residents, your homes will be planning for on-site vaccine clinics for you for both the COVID and the flu vaccine. So please speak to your homes about when these clinics are taking place if you haven't already. Next slide, please. The changes in the guidance came into effect last Friday. However, some homes may need some time to implement them and update their policies. The ministry will continue to keep residents, families, and caregivers informed, updated, and listen to their questions. Next slide. So with that, we'll open it up to questions. Melissa, back to you.
Thank you so much. Our first question will come from Stephen, who's compiled a few of the resident questions that came in during registration, and then we'll hear from Gail.
Okay, my first question is, if I'm expecting visitors and it's going to be an outdoor visit, do they still need to be actively screened as they would for an indoor visit? And secondly, do they need to wear the mask while outside? Let's say on the property of the home.
Thank you, Stephen. In terms of the changes to screening requirements, so homes now can shift to passive screening, which means people can self-monitor. However, we in consultation with the Chief Medical Officer of Health still strongly encourage and recommend active screening for visitors and caregivers that are coming into the home. Even for outdoor visits, the screening would apply. However, the testing that happens as part of that screening process, the rapid antigen testing, is not required for outdoor visits. I think there was a second part to your question.
Yes,
Masking.
Masking.
So the masks are required when you're indoors at all times, except for on the one-on-one kind of visits in a residence room if it's in a private space. Now I don't think they're required for outdoor visits. We encourage kind of like physical distancing. So I'm just double checking with Tanya that I'm up to date. Thank you,
Christine,
Erin.
I sent you the message. So from the guidance document, we actually have masks are not required outdoors for staff, residents, students, or volunteers or visitors. However, outdoor masking is still recommended and encouraged where tolerated as an added layer of protection when in close proximity to others.
Thank you.
Thanks, Erin.
Excellent. Gail, would you like to pose the next question, please?
Yes, absolutely. Thank you. My question is, since I am now able to receive visitors in my room and visit without masks on, can I look forward to enjoying a coffee or a meal together? And does this only apply to visits in my room?
Thank you, Gail, for the question and the opportunity to respond to that one. So yes, in the comfort of your room, you can enjoy your visit with your family and friends without a mask, assuming you're not sharing with another visitor, another resident, and that can include having a coffee or a meal with them in your room. However, for communal dining in the dining room, we are still restricting that to, visitors and caregivers need to wear their masks at all times. So unfortunately, at this time, in terms of that communal dining space, that's the visitor or caregiver can attend with you, but unfortunately can't participate in that meal at this time. But in the comfort of your room, your family member or friend can remove their mask and can share a coffee or a meal or a muffin with residents.
Thanks.
I know we've had a few questions populating in the question and answer box. I'm not sure if Erin or Anastasia will be answering or posing one live, or
I believe Tanya is, but I can pose if she's.
oh, sorry about that.
I'm happy to read them. So we have the first question here. Could a home go above and beyond for their PCR and rapid testing of residents? For example, when they are admitted, when they go to hospital, short absences, etc.
Thank you for the question. So in general, homes may go above and beyond when it comes to measures to protect health and safety. However, we do, one, it needs to be done, respecting all applicable laws, which includes the Fixing Long-Term Care Act and the Resident Bill of Rights. We encourage homes to engage with their resident council and their family council and their legal counsel, as well as local public health units around what is actually needed and appropriate. Where we have, the ministry has put specific kind of direction to homes to not go above and beyond. We've included that kind of in our communications and in the guidance. So for example, we're strongly encouraging that homes do not go above and beyond when it comes to isolation, that they're closely following the guidance that's been set out by our Ministry of Health and the local public health units, because we know how much of a toll isolation has taken on resident well-being. So that's one area where we've provided direction to homes around, really ensuring that if there is additional isolation required, that it's really at the direction and the advice of the local public health unit and needed in that moment. I know the question, I think, was more specific to testing. So again, the testing is an area that the home's policy might choose to go above and beyond, but they shouldn't be unnecessarily restricting absences. Like residents do have a right to visit with their visitors. We've removed the requirement for testing after an absence. So if you're going on a short absence, really the kind of evidence and value of that test at this point in the pandemic, unless you're showing symptoms, is not hugely valuable to protecting health and safety compared to other measures that are in place. So homes should be working with resident council, family council, their local public health unit, and following our guidance when it comes to testing and other measures. Thank you for that question.
Okay. The next question is from Maria. Now that visitors and essential caregivers can unmask in the room, if the visitor tests positive after the visit, will the resident need to isolate due to high-risk close contact?
Thank you for the question. So a couple of thoughts. So one, generally visitors are tested before they enter the long-term care home. I know there are provisions for caregivers to proceed to the resident's room while they're waiting for their test results, but they have to keep their PPE on and cannot remove their mask until that negative test result is received. So that's one area we'll just make sure is kind of clearer in our communications. Once they get that negative result, they can proceed with removing their mask. The other piece is caregivers don't necessarily need to test before every single visit, because if they're going 7 days a week, we only require they test at minimum 2 times per week. So there is a possibility that a caregiver might go to a resident's room and then later they find out that the person had COVID-19. So that would be considered a close contact of the resident. The change that's happened in the Ministry of Health guidance around case and contact management, though, now means that residents who are close contacts no longer need to isolate just because they're a close contact. unless they have symptoms or their roommate is the person who has COVID-19, in which case there's some guidance around how long the roommate would need to isolate for. So I think that will be a really critical and important change in kind of your well-being and living in a long-term care home. Is now, if you're a close contact, you do not need to isolate, again, unless you're showing symptoms yourself, or if it's your roommate who's the person who has COVID-19.
Thank you. Perhaps we can call on Stephen for the next question?
Well, it's going to be a two-part question now, Melissa. Okay, it's outbreak management. And it's, if my long-term care home is experiencing a continuous or extended outbreak in a home area with resident cases added each day, will there be a cap on how many days the resident on that home area should be isolated in their rooms? I was back last month. I got COVID and I was isolated for 18 days. I was the first one to get the COVID, but again, I was isolated for 18 days. Is that necessary? The second question is, if you have COVID and you're in a long-term care home, being at risk, when should you expect the antiviral medicine or prescription? Thank you.
Thank you, Stephen. So in terms of the first part of the question, while I can't speak to kind of the specifics of any like one specific outbreak, what I will say is that outbreaks are kind of managed by the home with consulting with their local public health unit. And it's really that local public health unit that's providing the overall kind of guidance and direction to the home. So every outbreak might be a little different in terms of how long residents might need to isolate for, or like if it's an area, like just a unit of the home that's an outbreak, or if it's, you know, affecting the entire home. So I can't put any like specific timelines on that. However, like one of the big changes, as I noted, was around if you're not experiencing symptoms yourself and you're a close contact, those individuals no longer need to isolate. So I think that'll help for many residents kind of in this circumstance. And then for those who do have COVID-19, it's really looking at, I think it's, and this is where I would call on my colleagues from the Office of the Chief Medical Officer of Health who weren't able to join us today, but there's usually like around 10 days is like the minimum kind of isolation period. And then after that, as long as symptoms are improving, then individuals no longer need to be isolated. But again, it's kind of contingent on like what the symptoms are and the unique circumstances of the outbreak. Now, there was a second part to your question around antivirals. So the main one we talk about is Paxlovid. And that one needs to be taken within 5 days of symptom onset or positive test for it to have the most benefit. So we have provided information to long-term care homes to see where possible to pre-assess some residents that might be at highest risk of like severe illness, where that's possible, so that they can get that antiviral kind of within that 5-day treatment window. So yeah, so there's like a 5-day period after symptom onset to get that antiviral. I don't know, Tanya, if you had anything you wanted to add to that.
Yeah, no, that's exactly it. And not all residents are eligible for various reasons. Interactions with other drugs, the drug cannot be crushed. So it's really important, as Christine says, to have clinicians pre-assess residents for eligibility.
Did that answer your question, Stephen?
I have a follow-up question. Is at the end of your 10 days, should you be tested to see if you're still going to have COVID? And at that time, should you not be isolated? I guess that's what I should have asked in the first place.
My understanding of the current guidance, and happy to just follow up in writing with this, is that you no longer need to test to kind of end the isolation. It's really based on that minimum kind of time frame, that 10 days, and then the symptoms improving, and for example, no longer having the fever. But yeah, the kind of symptoms improving for at least 24 hours.
Thank you, Stephen. Thanks, Christine. Gail?
Yes, thank you. My next question has to do with cohorting. Many homes are still imposing resident cohorting by home area or unit. What's the current guidance around gathering and group sizes if our home is outbreak free?
So I'm going to ask Erin to bring up the guidance on cohorting, because I don't have that at my fingertips. I know cohorting for some activities is encouraged, but I believe it's no longer required and really left to the home to determine what works best for its setting. However, we do encourage generally that residents can visit with other residents in the home if you're not in an outbreak situation. So
Yeah,
Erin, if there was...
I've got cohorting pulled up. Gail, can you repeat the question, please? I just want to make sure we answer it fully.
Yeah, it's what's the current guidance around gathering and group sizes?
Yeah, so cohorting is not required currently. And in terms of gathering and group sizes, if you're referring to activities, I can read you the portion we have in the guidance document right now. So it says social group activities may consist of larger groups, which could consist of more than 10 people. However, larger social group activities where potential crowding can occur should continue to be avoided, and IPAC measures should continue to be followed by staff, residents, and visitors to promote the safety and well-being. Does that help answer your question?
I'm not sure.
So no specific limits in terms of size of gatherings are set out by the province or by the ministry. So really kind of up to the home to determine what makes sense based on their space and kind of their home community. But strongly encouraging kind of some of those, like masking where possible, distancing where possible, as much as possible. So hopefully that helps. So the homes might have some limits or some policies in place, but nothing that's mandated by the ministry, aside from encouraging some of those best practices around like to help reduce transmission.
Okay, thank you.
Tanya, there was a question that I was going to, that caught my eye in the chat box that came in just a few moments ago from a resident that says that they live in a basic room, so a shared room with a half wall divider. And they were wondering why in this case they can't have family or friends visiting and taking off masks when there is a physical barrier between the two resident side of the room.
Okay, yeah, so I can answer that. So yes, that would be considered a shared room. So if the other resident is in the room, then all caregivers and visitors should be wearing their masks. However, if there's only just the one resident kind of in the room at the time, there's an opportunity for them to remove their mask. But if the other resident does come back into the room, or if a staff person comes into the room, then masks have to be put back on. We're also encouraging homes to find space, as best they can, like recognizing there are limitations on what homes might be able to do to be able to enable kind of mask-free interactions where possible, because we know how important it is for residents to see the faces of their friends and family.
I have a follow-up question for you, Christine, on that.
Sure.
If the persons in each room that are shared, if they have a relationship, does that apply?
So for example, if it's like a
Husband,
couple,
wife.
a husband
yeah.
and wife, and they're visiting with, yeah, so We are going to clarify in an upcoming memo, pending approval, but that, yeah, so as long as there's consent from the other individual, that if all the residents in the room agree to this, to allowing the family members or visitors to remove their masks, then that is kind of the exception to the shared room. So we're just working through the right language, and we expect to clarify that soon, because that would make sense. Like where the visitors are visiting both people in the room, like their maybe both their parents who are in the room, that we can enable the masks being removed in that circumstance.
Thank you.
The next question is around removal of masks and vaccination status. So are there different protocols surrounding non-vaccinated visitors removing masks in private rooms? Will those non-vaccinated be able to share coffee and meal with their loved ones?
So the masking requirements are not tied to the vaccination policies in terms of what the ministry has set out. I would just encourage folks to speak to their homes in case homes have put in place other policies. As we talked about earlier, homes can go above and beyond in some areas, but in terms of the ministry minimum requirements, we have not tied the masking changes to vaccination status. We know there are some homes though that do still have restrictions in place around visitors coming into the home who aren't vaccinated. So just do encourage you to speak with your home around the vaccination policy for your home.
You touched on this, Christine, but maybe kind of more broadly, what is the recommendation or guidance from the Ministry of Health regarding visitor and staff vaccination status?
Right, so as I was kind of just saying, the Ministry of Long-Term Care, Ministry of Health, there's no provincial requirements related to vaccination status. We do strongly encourage everyone to stay up to date with their vaccines, including the kind of new bivalent booster, which we talked about. Homes, however, can put in place their own vaccination policies for staff or for visitors. We have kind of clarified a few, circumstances where they cannot require a vaccination. So the vaccination policy should not apply to residents. So a home can't deny admission to a resident based on their vaccination status. We also clarified that the vaccination policy shouldn't apply for outdoor visits and shouldn't apply to visitors under the age of 5, just recognizing that young people have only just recently become eligible for vaccine.
Thank you, Christine. Gail, do you have another question?
I sure do. Okay, many common areas and resident spaces in our home have been taken over for IPAC and screening purposes. At my home, residents haven't had the use of our chapel space, lobby, or lobby areas for over 2 years. Is there any way our ministry partners can help residents reclaim these spaces in our homes?
Thank you, Gail. I really appreciate that question. So a couple of thoughts from me. One, the shift we've made to allow staff to self-monitor before they come to the workplace instead of requiring homes to do the screening on site, I think will help. Second, the ministry is looking at if there's any opportunities to reduce some of the testing kind of burden on homes. So for example, allowing staff to test at home before they come to the workplace. So no kind of decisions have been made yet, but maybe there are kind of some opportunities. And I think hearing feedback in terms of the impact that, having maybe it's your recreation and activity space, or the chapel space, as you mentioned, is one impact, will really kind of help move us along in terms of making some decisions there. So thank you for raising that.
And is that, when that decision is made, is that something that would be released in a further memorandum?
Correct. We would release something by memo, and happy to come back to do another one of these sessions, as we make further changes.
Great. Thank you very much.
Yeah, of course.
Stephen, do you have another question handy, or I know we've got a few more coming in the question and answer box as well.
Yeah, I've got one. If I go to activities in the community every week, and I do, and have been required to be tested on day 5 following each absence, I was. Based on the new guidance, will I be subject to testing after going out or just simply monitored for symptoms?
So that's right, Stephen. So the changes that we made in terms of ministry requirements now mean that if you go out, for a social dinner, or you go visit family for the weekend, you no longer need to be tested on day 5 after your return. You no longer need to be tested, rapid tested upon return, whatever. I would encourage you to talk to your homes just in case they've put in maybe additional protocols, but in terms of ministry requirements, we no longer require homes to test residents after they come back from an absence, such as a social gathering, and regardless of the duration, whether it's just a same day absence or a week-long absence.
Okay, thank you.
You're welcome.
There was a question that came through kind of related to the masking in the shared resident rooms. So in some of the newer homes, the newer builds where the shared accommodations simply means that it's a shared bathroom with 2 separate bedrooms on either side. The question is, in this instance, can visitors remove their masks, or is it considered a shared room where those consensus or those discussions have to happen?
I might need to take that one back, but if they're separate rooms, and I don't know, there might be different permutations of this in different homes in terms of the exact setup, but if they're considered private rooms, I'm assuming the bathroom's not used at the same time, that like only like one person at a time might be using the washroom. So I think probably fine for the visitors and kind of caregivers to remove their mask when they're in just the private room. But again, I don't want to speak for every kind of home setups. I know there's just so many differences across homes, but I think in general, if it's considered a private room, then that would be fine.
Thank you. Tanya, was there another question from the chat that you were hoping to pull out?
I think those are the main ones, Melissa. If residents have any other questions, we could turn to those.
Sure. Stephen?
Okay, I think you've already answered this, but I guess it just needs to be reiterated. If you've had COVID-19, and I am, what is the wait time before I be advised to get my influenza shot or my next vaccine booster? And do I need to wait the same time period for both?
Sure. So in terms of,
go ahead.
Go ahead.
No, I'm just saying after I've been diagnosed. Go ahead.
So in terms of what the guidance is for getting your COVID-19 vaccine, they do recommend waiting 3 months after your latest COVID-19 infection or after your last dose. So a minimum of 3 months that you should wait for your COVID-19 vaccine. For your flu vaccine, you don't have to wait any specific amount of time after your COVID-19 infection before you get your flu vaccine. And also just to note, and I think Tanya covered it in the slides as well, is people can get their COVID vaccine and their flu vaccine at the same time or in any kind of order before, at the same time or after. So people don't need to worry about what might happen if they get the vaccine at or around the same time. It has been found to be safe and effective to get both vaccines either at the same time or before and after one another.
Thank you.
Gail, do you have another question?
Yes, I do. Excuse me. If a resident or their residents' council group feels that their home is being stricter than necessary when it comes to visiting or screening or IPAC policies, who can they reach out to for support?
Sure, so I think first, and I'm assuming this probably is already happening, you'd be speaking to the home around your concerns and seeing if any of them can be addressed at the home level. If you feel that the home is like violating resident rights and infringing on resident rights in terms of where they're going above and beyond, we do have the ministry complaint process through the info line, and you could always lodge a complaint through that process. As like an in between those two, often we might also get inquiries at the pandemic response account. We have the email address here, and we're always happy to answer any questions and perhaps facilitate a conversation with the home and the local public health unit just to better understand the circumstances and see if there's a solution we can come to. But sometimes it is a decision that's made kind of by the home, and it's within kind of the parameters that are set out in kind of our laws. So not much more we might be able to do, but there have been situations where we've had the opportunity to kind of clarify changes to policy and intent and provide information on recent evidence that has been able to resolve issues. So that's also, you're also welcome to contact us at the pandemic response account.
Okay, and do you know what an average response time would be? If someone were to call one of those two groups?
So in terms of the pandemic response account, we do try to respond as quickly as possible. And generally you'll have at least some sort of response within a week. In terms of the complaint process, that's a formal complaint process that goes through our inspections branch and goes through kind of some fact finding and some triaging in terms of like what are the kind of highest priority complaints we need to deal with first. Like some are very like could be a serious complaint about a safety issue that we need to get through first. So there's a bit of a triaging and prioritizing that happens to those complaints, and that can take it could take several weeks or months to investigate a complaint through that formal process.
That's a long time without a shower.
Yeah.
Hopefully no one's going that long without a shower, but those would be kind of significant health and safety concerns, and definitely would warrant an email to the ministry. And I'm sure maybe Melissa was going to jump in, but I know you also have the OARC that's here to help advocate on your behalf as well.
Yes, thanks for mentioning that, Christine. That shower issue came to OARC's attention several months ago through discussion through our weekly resident forums. And we were having very concerned residents bringing this forward. So we were able to elevate this and share it with our ministry partners, who did follow up by circulating some updated guidance to clarify the expectation that bathing must be happening regardless of the outbreak situation in the home, that it was a part of a resident's care plan and an expectation. So Stephen and I had a great conversation yesterday, and I was going to ask him if he had any advice for, as these new directives are being implemented in different home settings, residents might have some home specific questions about policies and procedures. Stephen had a successful strategy, so I was going to invite him to share how he kind of raised awareness and got some questions answered.
Yes, at our last residential council, I invited the IPAC nurse to come in and to attend our council, which she did. And she answered questions about the vaccines, namely the flu vaccine and the COVID, and how long we should wait after we've had COVID for our next COVID booster.
Yeah, thanks for sharing that, Stephen. I think leveraging and working with the resident council is a great way to build partnerships and to put faces to names. Most homes do have that infection control lead who can provide that timely clarification when needed. So it can be very empowering to have those conversations and to kind of address the nuances of what's happening in your home. And they also would be the conduit or the connection with the local public health unit. So when we heard from Christine saying it might be a regional or municipal approach to handling things. So that's a great way to keep the communication lines open. Now with an election around the corner, we've got a municipal election happening. A few residents have reached out to OARC to express some concern or anticipation because their homes have been in an outbreak, or they don't know if their outbreak will be lifted in time, and wondering how can residents be, how can they expect to exercise the resident right to vote if there is an outbreak and perhaps they can't access the mobile poll in their room or in their home, if they can't go room to room, that kind of thing. Christine, could you maybe speak to some of the ministry guidance in this area?
Sure, happy to. Thanks, Melissa. So first and foremost, encourage you to speak with your home on how the opportunity for you to vote in your home. Your home should be generally working with the municipal clerk in your area to either hold on-site voting. There are requirements for homes. I think it's with at least 20 people to have on-site voting. Now I know we have a number of homes in outbreak, so your home should also be working with the municipal clerk on alternate ways to vote if that's required. And I know that every municipality is a little different in terms of voting methods. So some allow online voting. There might be opportunities for proxy voting. So just encourage you to connect with your home, because they should have been in connection with the municipal clerk responsible for the municipal election. Also, just to let you know that we have also been working with our counterparts at the Ministry of Municipal Affairs, and they've also sent out a message to the municipal clerks to make sure that they're working with homes on these alternate approaches, flagging that there are homes, and this applies to retirement homes and other settings as well, making sure there's opportunities for all residents to vote, and also just reminding of the health and safety protocols that we have in place, because we also want to make sure that everyone that's coming into a long-term care home is safe, for the protection of residents and for staff. So hopefully that helps. Just encourage you to talk to the home. The home should have been in touch with the municipal clerk in terms of options for voting in this municipal election.
Thank you so much. I know there was a question that had popped up earlier. I think it was a point of clarification regarding testing. When people have a test, why is it, not the expectation that people are waiting to get a negative result before going up to visit with a resident? So if there is any kind of guidance around that for screening and testing?
Yeah, so for testing, generally speaking, folks should be waiting for their negative test result before proceeding into the home. There are exceptions to that. So one is for staff. The expectation is that they're tested at the start of their shift. They can proceed with PPE into the home, but they should not be providing direct care to residents until they receive a negative test. The other exception we also talked about earlier as part of another question is for caregivers. They are permitted to proceed directly to the resident's room, so not to a communal space, but to the resident's room, again with the appropriate PPE, until they get their negative test result. But for general visitors, they are required to wait until they get a negative test result before they can enter the home.
Excellent. Thank you so much.
There's one more question here about outbreaks. To clarify, if we are in an outbreak, do we still allow unmasking designated area and allow loved ones to unmask in the room of a resident who is not isolating?
So that's a good question. So again, when there's an outbreak in the home, you'll be following the direction of the public health unit. I imagine most public health units will be recommending and advising about masking during an outbreak situation. So, you know, the changes that we've introduced are really if the home is not in outbreak, and when it is an outbreak, the local public health unit has kind of oversight of kind of the rules that are in play at that point in time.
Great, thanks, Christine. And here's another couple trickled in. If we have more than one visitor in your room, can all visitors remove their masks, or is it only allowed for one-on-one visits?
Yeah, so thank you for the opportunity to clarify that. So all the visitors that come to visit that one resident are permitted to remove their mask. It's really if there's another resident in the room, or if there's a staff person, a volunteer, a support worker in the room, that masks need to be worn. But if that group of visitors is visiting that one resident, that group of visitors can remove their mask.
I just wanted to confirm that Stephen and Gail, did you have any other questions, or if we capture? Oh, Stephen does. Okay, maybe we should let Stephen have the last word. I know.
I have another question as well.
Oh, okay. We'll let you each deliver a final question. I realize we've had a very fulsome conversation, and thank you to our ministry partners for staying on to answer these very important questions. So
Gail, I'll let you go first.
Okay, thanks, Stephen. First of all, I'd like to say thanks for providing the explanations around the last ministry memo. Right now, I'd like to ask if you know when the next memo would be coming out that would be lifting the remaining restrictions, thereby affording residents in long-term care the same rights and freedoms as everyone does have right now in community.
Thank you for your question, Gail. What we're kind of seeing now in terms of the guidance that the ministry has put out is really setting kind of what our baseline approach is over this fall and winter. We are expecting this could be a challenging season with more flu than what we've seen in the past, as well as COVID. So apart from maybe some minor tweaks, I think in general, this is the guidance that we'll be following over the course of the fall and winter. There's probably opportunities to clarify, as you know, some of the questions that even came up today, but in general, this is kind of the response over the fall and winter. We're closely monitoring the situation in the event that there is a more severe kind of variant. Hopefully that's not the case. Right now, we're not seeing any signals of that. It's kind of Omicron type COVID viruses that are circulating. But yeah, I think in general, the approach that we're taking over this fall and winter is the guidance that you're seeing. Aside from, like I said, there's some opportunities to clarify a couple of pieces. So I think just to add, I think we'll see a lot of positive changes coming out of this. I know some homes, like Tanya mentioned, might take a little bit of time to adapt their policies, but the removal of isolation of close contacts, I think is a big one. Not having to test after you go out for a social visit, I think is another big one. Being able to remove masks in your room. I appreciate that there are still restrictions and that those are really challenging on all of you. We are trying to strike that right balance between ensuring the health and safety of residents and the staff that work in long-term care, with also prioritizing your well-being and your quality of life in long-term care. So we're hoping we've kind of moved towards that with these changes, and I appreciate it. Probably doesn't go as far as some of you would like. So I mean, we'll continue to look at it, but I appreciate kind of the question and Sorry.
Yeah, I would just ask you to remember while you're deliberating those points, that you remember that we are now entering year 3 in long-term care, living under the auspices of this requirement.
Completely
And
understand.
it's not good. And the new restrictions, the new lifting of the latest restrictions doesn't go far enough to give us our lives back.
I would also just welcome an opportunity to hear more as well. Maybe we can find other time to talk more about this, or even through the email address. If you have some suggestions on other things you'd like us to look at, we can definitely, you know, take a further look at some of the areas that you think are impacting on your lives the most that we haven't touched on yet. So also, like, what we can continue to look at these things.
Thanks
That would
so
be
much.
great. Thank
Yeah.
you very much.
Thanks for that great question, Gail, and thank you to Christine for answering and for keeping that door open on further discussion. I know we would welcome the opportunity to even think proactively about holiday time and to have resident input as we kind of anticipate and plan and work together on some updated holiday guidance documents and that kind of thing. So we've certainly collaborated in the past in that vein and look forward to continuing the conversation with resident perspective and guidance. So Stephen, we're going to let you have the last word as we approach 3 o'clock. So
Okay. In a COVID outbreak, if one of the residents' tests are inconclusive for COVID, they're kept in isolation. Do they, while being closely monitored, do they have a recourse to have a blood test done if they want to do so?
I actually don't know if there is a good blood test for a diagnostics for COVID-19. I know there's a blood test that can test your antibodies, and that just shows if you've had a COVID-19 infection in the past. It might not say if you currently have one. So I think it is really the PCR or the rapid antigen test. I don't know how often they're inconclusive. Is this something that's happening regularly? Because maybe that's something we can take back to our Ministry of Health colleagues, and we can kind of look into that process a little bit more in terms of if that's causing unnecessary isolation. I think that's something we could look into.
I think inconclusive would be like a false positive or a false negative. In our home area, we had one person that was inclusive and they were kept in isolation.
And then did they do another test?
That I don't know, but I just thought I would throw in about having a blood test. Now the antigen, that would show up if you've had a booster shot though too, right?
The blood test? Or
Okay,
the rapid antigen test, which is like the rapid test that you do with the swab. It shouldn't turn positive just because you've had the vaccine. There are issues sometimes with false positives or false negatives with it, but the PCR test is pretty reliable. So if that one is positive or negative, that's a very reliable test.
okay, thank you.
thank you so much, everyone. We've spent the full hour together. I wasn't sure the questions really trickled in there in the end. I do apologize. We haven't been able to answer every single question, but I do really encourage some of those questions might be a great starting point for a discussion group or a resident council conversation by inviting a guest to an upcoming meeting to get some clarity. Maybe it's just learning. There was a question about different symptoms between COVID and distinguishing that from the flu. So those are great conversations that you could have with your infection control lead in the home. And as our ministry partners have shared earlier, anything pertaining to the scope of today's session or anything that maybe we didn't touch on can be raised through the various ministry channels. So thank you so much to our panelists today. I really have appreciated having Stephen and Gail's participation in bringing the resident questions to the forefront and having our ministry guests navigating and giving some responses today. So thank you very much for everyone for tuning in. And as I mentioned at the beginning, we will have the recording available as well as the slides for those who missed the session or perhaps wish to bring this back to share with other residents and team members. And you can let friends and family know that there will be a webinar for them on Thursday at 1:30. So there is time for family and friends and people of importance to residents to get registered for that follow-up webinar. So thank you so much. Have a great afternoon, everyone.
Thank you.
Okay.